What were those five? Were they contracted at transmission events outside of the Avalon RS building in Avalon?
So I would have to get the breakdown of the details of the cases, but my recollection is that they're all really linked to the events, to the sites in the Northern Beaches where we've identified cases of concern. So there's nothing suspicious there. I'll have to check, but there's two questions: whether they were isolated at the time. I believe that's increasingly occurring. Whether they were isolated for the full infectious period, which is the 48 hours, I will also get you that information.
That Sydney case that's popped up in
Their health minister has said that they stopped at a regional county in New South Wales.
Yes, that's correct. So, yes, certainly. So the family stopped at Oliver's Real Food Outlet at Gundagai mid to late afternoon on Wednesday the 18th of December. So advice will be going out to the community in Gundagai who may have also accessed that real food outlet.
Kerry, Chant, the 8th case in this nurse transporting people from the airport. Did that nurse have any interaction with the returned traveller that came in on December 1 that tested positive in hotel quarantine?
The person transferred the healthcare worker who is involved in the transport, which is the 8th case that we're under investigation. We are aware that they transported a symptomatic family of 3 from the airport on the 14th of December. And
genomic sequencing will come back on this case tonight.
Will be come back later today. Can I let you know that we will release the results on the genome sequencing as soon as we have it? It's clearly a relevant point to our investigation. Obviously, I tell you every time that we take an open mind. Obviously, given that history, we would believe that the person acquired it through their work in transporting the patient, but we always keep an open mind. And but no links to the Avalon cluster were determined for that person.
Where did 3 come from, Kerry, Chant? Where did the family of 3 come from when they were returning?
US.
This could potentially be the 3rd incident in the past few weeks where we have had something creeping out from a hotel quarantine. We had the housekeeper at the Novotel Ibis. We've potentially had this lady who's come back from the United States, and now this 8th case today. Is this virus getting more contagious, and is our line of defence in New South Wales strong enough from stopping it creeping into the community?
So that we don't have any evidence that there's fundamental changes in the viruses that we've been encountering that would indicate any difference in transmissibility of the virus. What I think is important to know is that clearly if you're transporting 3 infectious patients, we need to review. This notification came in yesterday. We have worked very quickly to look at all of the aspects of that might have been associated with that transfer, but the person did transport 3 infectious patients. We will just look at whether there are any breaches, and sometimes those are inadvertent. So sometimes a patient will take off a mask. Sometimes a patient doesn't tolerate wearing a mask at a particular point in time. So there are always a number of elements here. I don't want to speculate until we have the genome sequencing and we've done a thorough investigation.
Do you think that we should stop flights from the UK, given this super strain that is coming out? Do you think we should stop receiving them in New South Wales?
So the Australian Health Protection Committee considered the information about the UK strain. Obviously, we need to, I suppose the advice is take a precautionary approach, but there is a lot of science to still work through. There may be very many other reasons that explain the observed increase in transmissibility of that virus or the growth rate of that virus. So what we need to do is just redouble our efforts to make sure everyone is aware of the infection control requirements.
There have been 6 cases, Dr. Chant, 6 cases linked directly with hotel quarantine or transporting returned travellers or aircrew. The 2 security guards months back, the hotel cleaner, the van driver, this transport healthcare worker and a close contact of this transport healthcare worker. Clearly there's some leakage in the system. What do we need to do to ensure it doesn't happen, also considering that the virus may have leaked from this returned traveller on December 1 into Avalon?
So we understand that this virus can be highly transmissible and people can be highly infectious. There's often variabilities in individuals in terms of their stage of infectiveness. It is important that we make sure the end-to-end process of people that are returned overseas protects the broader community spread. But can I just say, it is actually a credit that we pick up some of these transmission events. So part of the issue is that occasional transmission events will occur, but the fact that the person came forward for testing means that the system's right in that we can prevent any further transmission to the community. So I don't think any system can ever guarantee that we won't have any transmission events. Other similar situations, such as New Zealand, have had a number of incursion events as well. It is also about how you surveil, pick them up and respond to them that is important. I think it's inevitable that these issues will arise. We try as best we can to minimise them, but it is about the response and the actions of individuals and coming forward.